Maintaining a low and steady blood sugar will not only improve your health, but also cut carb cravings and allow your body to release stored fat. In this video, we will go over 9 food, supplement, and lifestyle changes that you can make to lower your blood sugar naturally.
Okay, so the first and probably most obvious one, right,
For us,
is to just lower your carbohydrate intake. So in the US, the dietary guidelines for a 2,000 calorie diet per day for, I guess, the average individual is 225 to 325 grams of carbohydrates. That's a massive amount of carbohydrates.
It is for our low carb and keto community for sure.
Yeah.
Well, and actually it allows a little too much wiggle room for anybody. But what that means then, and if we look at the cutoffs for low carb, well, we have to bring our carbs down below 125 total carbs. If you want to go into the keto range, you need to be under 50 total carbs.
Right.
So that means from where the average person is, that if they want to go low carb, they have to cut their carb intake by at least 1/2.
Yeah, and maybe 2/3 or more, depending on how, just where they're at on that spectrum, right?
Well, and the thing to know there is if it is something that you are looking to get started in, you simply have to start with knowing what foods to choose to live a low carb lifestyle. And we have a downloadable list of 100 low carb foods that is really, really handy. We'll point you to that, and that'll help you get started.
Right. So the next thing to look at is the fiber-to-carb ratio of knowing the best foods to be including in your diet. Fiber is going to slow digestion and absorption of the carbohydrate portion of those foods.
Right, yeah, and so that's going to help you keep from spiking up your blood sugar. And so we have a couple of examples to give you an idea of what it means to be a good fiber to carb ratio. And an avocado, a great example. So avocados have 6.8 grams of fiber, but only 8.6 carbs. So it has a lot of fiber for the carbs that it contains. In fact, that's like 80% of that avocado is carbs are fiber. That is a very good fiber to carb ratio. If we compare that to a baked potato, which will be 2.2 grams of fiber in 21.2 grams of carbs. So there we're at more like the 10% fiber range.
Pretty low.
Yeah, and what's going to happen when you have those two different foods is that baked potato is going to raise your blood sugar much quicker because of the lack of fiber.
And we should also talk about, refined foods, right?
Yeah.
So refined grains, refined flours, those types of things.
Yeah, so anytime that a food is refined, it's milling out the parts of that food that are going to spoil. Fiber oftentimes is part of that. So if we take, for instance, white bread has 2.7 grams of fiber and 49.4 grams of carbs. So that's a very, obviously a high carb food, but just to give you an example, that is like less than 5%, I think, or something like that.
And so we're talking about white bread and baked potatoes. We should maybe mention the glycemic index.
Yes, right. So the glycemic index is a great thing to bring up in a video that's on blood sugar, because what the glycemic index does is it ranks food dependent on how much they will raise your blood sugar. A wonderful, wonderful tool, but it has some limitations. And one of the main limitations is that there's a lot of different foods to test. And to get this ranking, they need to have human subjects. So that's going to not only take a lot of time, but take a lot of money. So it takes a long time to catalog the foods into the glycemic index. And another limitation that I'll mention is that sometimes the results that show up on the glycemic index aren't common sense. For instance, sugar, so we're talking about raising blood sugar. Well, if you take a tablespoon of sugar and you eat that, well, guess what? It's not going to raise your blood sugar as much as eating that white bread or the baked potato that we talked about, because they have a higher glycemic index. Yeah, there we go.
Doesn't make sense.
No.
The next factor that we're going to talk about is sleep, getting quality sleep. And I think quality sleep is a big issue these days. I mean, you can't watch TV or even listen to the radio without hearing an advertisement for some new mattress or something, right? That's going to help you
sleep better.
I like the Counting Sheep one, my favorite. I still like those guys. But sleep, if you're not getting quality sleep, if you're waking up through the night very restless, that is going to increase your cortisol level, and that is going to increase your blood sugar level. So when your blood sugar goes up like that and you're not sleeping well, you're also going to get an increase in appetite, which indirectly could raise your blood sugar,
right, if you're
depending on what you're eating.
If you're eating more bad foods, right? And actually that is an important part of this whole idea of getting better quality sleep for better blood sugar control, because the type of diet that you follow matters. When they took test subjects and they gave them different style diets, they slept differently. So basically what they found was that those who followed a high carb diet fell asleep quickly, but those who had a high fat or high protein diet had better quality of sleep. And that was one of the things that came of that, was that they had fewer episodes of waking up during the night.
Right.
So we go to sleep quickly if we eat a lot of carbs, but we sleep better when we eat a higher fat.
Right, and I think, we've all experienced that, right? You have some high carb food, and then, you're falling asleep in your cubicle,
you can't stay awake.
at the middle of the afternoon.
Yeah.
And I know that, before I was on keto and was heavier, I would often, be sleepy all throughout the day. But then I would be up till, 2 o'clock in the morning.
Yeah. Your sleep
It was
completely off.
just way off.
Yeah, and that was diet related.
Yeah, it absolutely was. So let's talk about exercise. So regular exercise is also a good way to make your body more insulin sensitive. So what that means, if you're not familiar with that, is that when your blood sugar goes up, insulin is secreted to get that sugar out of your blood and into the cells. If you're insulin sensitive, it doesn't take very much insulin to pull that blood sugar out. If you're insulin resistant, which many people are, it's going to take more and more insulin, and it's going to be like trying to push glucose into the cells. It's going to be very resistant to that glucose.
Yeah.
And when your insulin's up, you got a lot of things going on, inflammatory things. You're not burning fat at that point in time.
Well, and the interesting thing from the research on exercise and insulin sensitivity is that it can improve really quickly. So even after one exercise episode, this was done on healthy men, they found that their insulin sensitivity improved for the next 24-hour period. Kind of the caveat with exercise is that it's not just once and done, so you have to keep exercising. When researchers took a group of trained athletes and measured how insulin sensitive they were, and then gave them 10 days off, well, that rest period lowered their insulin sensitivity. So the thing is that you have to keep exercising.
You got to use it or lose it,
to get the
all right?
benefit.
So the next thing we're going to talk about is something that's called early intermittent fasting. There's more and more research coming out about this. So it basically is kind of shifting your intermittent fasting to an earlier point in the day, and it's been shown to both increase your insulin sensitivity and lower your blood sugar.
Right. Yeah, and this is something that the research is really, you start to see more and more of. There was one study, for instance, done on pre-diabetic men. They shortened their eating window to 6 hours and had them stop eating for the day by 3 p.m. and they improved their insulin sensitivity. So it is something that is significant, and you can back that up with your own personal experience.
Right. So for the past few months, I've been trying this protocol. And a number of you have asked about it in the comments, so I'm going to throw it out here finally, right? So I started doing this early intermittent fasting where I would eat breakfast, and then within 6 hours I'm having my last meal. And typically, that's going to be by 2 p.m. in the afternoon at the latest, just depending on when I get my breakfast in. And I have noticed, my blood sugar level being very low, very steady throughout the day. I wake up in ketosis now, which historically that's been a huge problem for me. So it actually kind of reduces the effect of the dawn phenomenon, which we'll go into a little bit later. And I've noticed that when I am strict with this, and I can't do it every day because socially, sometimes we have dinners and things. So I have to plan ahead, and if I'm going to do a dinner, I don't have the breakfast, I do the lunch and the dinner. But on the days that I am doing this, I am definitely seeing, improvement in my weight, almost on a daily basis.
Yeah, it's a remarkable difference, and something that it seems like a small switch, but it has remarkable results.
Yep.
All right, let's switch gears to supplements that you can utilize to naturally lower your blood sugar. And we'll start with one that we've talked about a couple of times on our channel called berberine. In fact, we have a video that we'll point you to on berberine and how it can naturally lower cholesterol levels. On my second YouTube channel, I did a video on reducing liver fat with non-alcoholic fatty liver disease and how berberine helps with that. So if you're interested in fatty liver disease, we'll point you to that as well. But berberine also has a very good blood sugar lowering effect.
And I've been taking berberine for several years now. I started taking it because we had a strong belief that I was at least pre-diabetic when I started all this. Obviously some lipid issues too. So the double effect of the cholesterol and the lowering the blood sugar was a good thing for me. I take it on a daily basis. Honestly, I don't know what it does because I would have to like stop taking it and test and everything, and I just don't want to do that. So.
Right. Well, but we can lean on the research, and even on people that are fully type 2 diabetic. When they were given berberine on a regular basis, I think it was a gram of berberine for 3 months, their blood sugar levels in the morning went from an abnormal level, I think it was 126 milligrams per deciliter, down to a normal range. So berberine is a good supplement for naturally lowering your blood sugar. Another supplement that we talk about often is apple cider vinegar. And in fact, we have a video that we dedicated specifically to apple cider vinegar and improving insulin sensitivity. In fact, it's probably one of our most controversial because we took a beating for it.
1, 2, 3. Oh.
Okay.
Thumbs up on the apple cider vinegar. Biting my tongue right now because I just want to say, yes, we know. Dilute it.
All right. Yeah. In the video, we shot down apple cider vinegar directly and got scolded quite a bit.
Oh, well.
But anyway.
Yeah. Apple cider vinegar, I mean, it's a great thing, right? It's been, this has kind of been known for a long time. It's readily available in grocery stores. It's affordable. It's easy to do. And it's got some really good effects to it. It also has a pretty good effect of lowering the dawn phenomenon when it is taken the night before.
Yeah, and the dawn phenomenon is if you wake up with an abnormally high blood sugar level, that's often referred to as the dawn effect or the dawn phenomenon. And if that is a case for you and you are looking specifically to lower your fasting blood glucose in the morning, the research studies that we look at as far as dosage, typically we're looking at 30 milliliters at bedtime, which is the equivalent of 2 tablespoons.
Put it in some water so it's diluted.
All right, so let's switch gears to talk about cinnamon. And I wanted to include cinnamon in this video because it is one of those, I think that everyone's kind of heard. It kind of makes the headlines sometimes because it's a convenient, easy thing and it's a good taste. But it almost has that old wives' tale effect. Like, does it really work? Well, there is research for sure that backs up that cinnamon is effective for lowering blood sugar. So if you want to include that in your daily routine, that's great. And according to research that was cited on Healthline's website, an effective dose is 1 to 6 grams of cinnamon per day, which would be about a half a teaspoon to 2 teaspoons.
But don't be dumping it in your mouth,
Right. Yeah.
Mix it into something.
You can't take cinnamon just straight. So mix it in something. Mix it in your coffee. Mix it in your tea. Maybe you guys can share if you take cinnamon on a regular basis, how you utilize it in your diet.
All right. So our final thing, number 9, right, is mellow magnesium.
Mellow magnesium. Thank you,
Yep.
dear. That's mine.
Yep.
That's my
So magnesium is involved in hundreds of enzymatic processes in your body. It's also well known for handling muscle cramps,
Right.
which can be a problem for low carb dieters because you cut your carbs, you lose a lot of water, and that can cause some cramps.
So mellow magnesium, we call it that because it mellows you out, whether it's muscle cramps or mood or things like that. It is important for those things. And the research shows that about half of the U.S. population is actually deficient in magnesium. But it's an easy thing for you to get into your diet. You can utilize a electrolyte supplement like Endure, which is one that we talk about often on our channel, and we utilize it in our house. But you can also get magnesium from foods. One of the best ways is to prepare a really good tasting salad that has dark leafy greens, avocado, sunflower seeds, pumpkin seeds. These foods are a rich supply of magnesium, and they taste great on a salad.
And the reason that we're including magnesium in this discussion of how to control your blood sugar is that they found out that magnesium deficiency leads to a higher risk of diabetes.
Right.
So it is a key player in there.
Yeah, that's a very good point.
Yeah.
and most of us are deficient, so get some more magnesium in no matter what. So there you go. Those are 9 different ways that you can naturally lower your blood sugar. And the added bonus of all of these is that they will help you to lose weight, which in and of itself is a way of stabilizing your blood sugar. It's kind of one of those
We call that number 10 if we
Okay,
wanted
there
to.
you go. Oh, we could have done 10 then. But of all of these things, the starting place that you're going to get the most benefit from is to lower your carb intake. If you are looking for a reference, download our list of 100 low carb foods, and that will get you jump started. Hey, thanks so much for watching. Please subscribe to our channel, and we appreciate you watching. Thanks so much. Have a great week.